Coronavirus COVID-19 is a respiratory illness caused by the SARS-CoV-2 virus, first identified in December 2019 in Wuhan, China. It led to a global pandemic, affecting millions of people worldwide. The virus primarily spreads through respiratory droplets and can cause a wide range of symptoms, from mild to severe, including death in some cases, especially among vulnerable populations such as the elderly and those with pre-existing health conditions. Symptoms of COVID-19 symptoms can range from mild to severe, with some individuals being asymptomatic showing no symptoms. Common symptoms include 1. Respiratory symptoms, fever or chills, cough, shortness of breath or difficulty breathing. 2. Systemic symptoms, fatigue, muscle or body aches, headache. 3. Gastrointestinal symptoms, sore throat, loss of taste or smell, anosmia, congestion or runny nose, nausea or vomiting, diarrhea. 4. Severe symptoms, persistent chest pain or pressure, confusion, bluish lips or face, inability to stay awake. In severe cases, COVID-19 can cause pneumonia, acute respiratory distress syndrome, heart, kidney failure, and other complications that may require hospitalization or intensive care. Transmission: COVID-19 spreads mainly through respiratory droplets. When an infected person coughs, sneezes, or talks, the virus can be inhaled by others nearby within 6 feet. Airborne transmission: in poorly ventilated areas, small aerosol particles can remain in the air and infect people farther away. Surface contact: although less common, the virus can spread by touching surfaces contaminated with the virus and then touching the face, especially the mouth, nose, or eyes. Risk factors: certain groups are at higher risk of severe illness from COVID-19, including older adults, especially those over 65, people with underlying health conditions, such as heart disease, lung disease, COPD, asthma, diabetes, obesity, immunocompromised individuals, e.g., cancer patients, organ transplant recipients, pregnant women. Diagnosis: COVID-19 is diagnosed using the following methods. PCR polymerase chain reaction test detects the genetic material of the virus. It is considered the most accurate and widely used diagnostic tool. Rapid antigen test detects specific proteins from the virus and provides results more quickly but is less sensitive than PCR tests. Antibody test detects antibodies in the blood that indicate past infection, but it cannot diagnose an active infection. Treatment: there is no specific cure for COVID-19, but treatments focus on relieving symptoms and supporting the body's immune response. Treatment depends on the severity of the disease. 1. Mild cases: self-isolation and rest. Hydration and over-the-counter medications, e.g., acetaminophen for fever and pain. Monitoring symptoms for worsening conditions. 2. Moderate to severe cases: hospitalization may be necessary for severe cases requiring oxygen therapy or mechanical ventilation. Antiviral medications such as remdesivir have been used in severe cases to reduce viral replication. Dexamethasone, a corticosteroid, is used to reduce inflammation in hospitalized patients needing oxygen support. Monoclonal antibodies may be given to high-risk patients with mild to moderate illness to prevent progression to severe disease. Ventilatory support for patients with severe respiratory distress, including the use of mechanical ventilators. Vaccination. COVID-19 vaccines have been instrumental in controlling the spread of the virus and reducing severe illness, hospitalization, and death. Several vaccines were developed and authorized for emergency use by regulatory agencies worldwide, including Pfizer-BioNTech Comirnaty, Moderna, Johnson & Johnson's Janssen, AstraZeneca, available in some countries. These vaccines work by stimulating the body's immune system to recognize and fight the virus if exposed in the future. Booster doses are recommended to maintain immunity, especially in high-risk populations. Preventing the spread of COVID-19 involves a combination of vaccination, public health measures, and individual actions. Vaccination, getting vaccinated and receiving booster shots is one of the most effective ways to prevent severe illness and reduce transmission. Wearing masks, especially in crowded or indoor settings where physical distancing is not possible. Physical distancing, keeping at least 6 feet away from others, particularly in areas with high transmission rates. Good hand hygiene, regularly washing hands with soap and water for at least 20 seconds or using hand sanitizer with at least 60% alcohol. Avoiding close contact, minimizing interaction with sick individuals and avoiding large gatherings. Improving ventilation, keeping indoor spaces well ventilated to reduce the concentration of airborne virus particles. Variants of COVID-19. The SARS-CoV-2 virus has mutated over time, leading to the emergence of variants with different characteristics, such as increased transmissibility or resistance to antibodies. Some notable variants include Alpha, first identified in the UK, more transmissible than the original strain. Delta, associated with more severe illness and increased transmission, responsible for a significant wave of infections globally. Omicron, known for high transmissibility but generally associated with milder symptoms compared to Delta. Subvariants of Omicron have continued to emerge. Long COVID, post-COVID syndrome. Long COVID, also known as post-acute sequelae of SARS-CoV-2 infection. PASC refers to persistent symptoms lasting weeks or months after the initial infection. Symptoms may include fatigue, shortness of breath, cognitive difficulties, brain fog, joint or muscle pain, loss of taste or smell, sleep disturbances. Long COVID can affect individuals of any age, including those who had mild or asymptomatic infections. Conclusion: COVID-19 is a highly contagious viral illness that has caused a global pandemic with significant health, social, and economic impacts. Vaccination, combined with public health measures, is key to controlling the spread of the virus and reducing severe illness. While treatments for COVID-19 have improved, prevention remains the best defense against the virus. continued vigilance, including vaccination, mask wearing in high-risk settings, and good hygiene practices, is essential to protect individuals and communities from COVID-19.